Suctioning is a medical procedure that removes secretions like mucus, saliva, or blood from a person's airway. It's very important because these secretions can block the airway and make it hard to breathe. This is especially crucial for babies, young children, and people who can't cough strongly enough to clear their airways on their own. Think of it like using a tiny vacuum cleaner to gently remove anything blocking the airway. This helps people breathe easier and prevents serious complications like pneumonia. This procedure is commonly used in hospitals and other healthcare settings, but it can also be performed at home with proper training and equipment. Suctioning is a safe and effective way to clear the airway when performed correctly. However, it is important to use the right technique and equipment to avoid complications. Always consult a healthcare professional for guidance on suctioning. There are two main types of suctioning procedures: oropharyngeal and nasopharyngeal. Oropharyngeal suctioning is used to clear the mouth and back of the throat. This is usually done with a Yankauer suction tip, which is a rigid, angled tip that is inserted into the mouth. Nasopharyngeal suctioning, on the other hand, is used to clear the nasal passages and the back of the throat. This is usually done with a flexible catheter that is inserted through the nose and down into the throat. The choice of which type of suctioning to use depends on the patient's age, medical condition, and the location of the secretions that need to be removed. In addition to these two main types, there are other types of suctioning procedures, including tracheostomy suctioning, gastric suctioning, and suction and evacuation. Tracheostomy suctioning is used to clear the airway of people who have a tracheostomy tube. Gastric suctioning is used to remove fluids and gas from the stomach. Suction and evacuation is a procedure used to remove uterine contents during a miscarriage or abortion. The amount of suction pressure used during a suctioning procedure is important. Too much pressure can damage the delicate tissues of the airway, while too little pressure will be ineffective at removing secretions. The appropriate suction pressure varies depending on the patient's age and the size of the catheter being used. Here is a general guideline for suctioning pressures. Infants, 60 to 80 millimeters of mercury. Children, 80 to 100 millimeters of mercury. Adults, 100 to 120 millimeters of mercury. It is important to note that these are just general guidelines. The actual suction pressure used may need to be adjusted based on the individual patient's needs. Always consult a healthcare professional for guidance on the appropriate suction pressure to use. Suctioning is indicated when a patient has difficulty clearing their airway on their own. This may be due to a variety of factors, including thick secretions, weakness, or unconsciousness. Thick mucus or saliva can be difficult to cough up, especially for infants, young children, and people with certain medical conditions. People who are weak or recovering from surgery may not have the strength to cough effectively. People who are unconscious are unable to clear their airways on their own. While suctioning is generally a safe procedure, there are some potential complications. These complications are rare but can be serious. Some of the potential complications of suctioning include trauma to the airway, hypoxia, and infection. If the suction catheter is inserted too forcefully, or if it is not lubricated properly, it can damage the delicate tissues of the airway. Suctioning can remove oxygen from the airway, which can lead to hypoxia or low blood oxygen levels. Suctioning can introduce bacteria into the airway, which can lead to infection. To minimize the risk of complications, it is important to use the correct suctioning technique and to follow the instructions of a healthcare professional. If you are unsure about how to perform suctioning safely, be sure to ask for help.